thank you, Dr. Bhattacharya, for such a fascinating lesson in history. I know it's a discussion, but it's seriously so eye-opening, and such investigative work is really it actually interests people the most, because we don't know such inside stories when it comes to eradication histories which are being studied. So thank you so much. And I would like to ask Dr. Khandait to share his views, maybe related to polio eradication, because that's something which I'm sure touched and took a lot from smallpox eradication programs in India. Yeah.
So, thank you, Shankar. This is such an honor to be here, sharing dais with Sanjay and Anjali's pleasure, honor. Sanjay, when you were speaking, I was feeling like, is it a deja vu? I had an opportunity to work for polio eradication for 11 years and staying in 175 districts in India. So, and leading the polio eradication in UP, Bihar, Western India, and all other places. So, while every line you were saying, oh, I thought, wow, I can give 3-4 examples for polio eradication. And if your speech is if I cut the smallpox word with the polio, it can be a speech on polio eradication also. Everything from and one of my mentor initial days, I was crying to why there is so much politics in public health. He said, it's public health, it's public, so long as there is public, there will be politics. So why are you so much worried about it? I thought, are we learning from the past? And while Sanjay was speaking, I thought, I cannot tell anything more beautifully what Sanjay told about smallpox. And 10 minutes is not the time, I should repeat the same history of smallpox with polio eradication. So I should tell you the story. So if there is a intent, I can tell. So in 1657, a French mathematician, Pierre Fermat, he set a problem to his friend Bernard. It was in 1657. And what was the problem? Problem asked for the solution 61x square plus 1 equal to y square, and x and y are integers, so give me the solution. And they could not solve the problem. So it was in 1732, that is almost at after 75 years, they got the solution by another great mathematician, Leonard Euler. He solved it. And just to find out that this problem was already solved 580 years earlier in 1150 by Bhaskaracharya II, where x equal to 22, 61, 53, 980 and y as some similar long number. And that method was called a Chakrawala method, and it is mentioned in Siddhant Shiromani of Bhaskaracharya II. Now, what was the Bhaskara II's problem? If he had written in 580 years back, why the world still struggled? Why couldn't they just copy and paste from Bhaskara II? Because Bhaskara II specifically thought, came with a great mathematician of his time, he thought that mathematics is a very complex subject. It's subject of an elite, very few understand. So let me convert the mathematical problems into poems. And he wrote a great treatise in mathematics called as Leelavati. That's a famous book in mathematics. And the name of the daughter of Bhaskara II was Leelavati. Now all the mathematical problems were written in a very mathematical, in a very poetic way, described in trees, flowers, etc., mountains, etc., and the solutions was there. But in spite of such a beautiful book, after 600 years, 500 years, people were struggling, and 600 years, they got the same answer, what he did. when I was listening to Sanjay, I was feeling that, wow, history often repeats and this is not, we are not alone. So it is since 1100 and it is since many, many years that we do have a habit of not listening to the history and reinventing the wheel and again carrying that phenomena forward. So then my question is, what I thought was, why do the people continue to reinvent the wheel when they can save a lot of time? So sorry if you are going to listen, came here for listening on polio eradication, that is some other time. I thought, let's address this question, ki after this such a powerful speech, why can't we learn the same lessons? Why polio eradication took so much time and why couldn't we have just copied some of those lessons? Because there were so many parallels. When Sanjay said, oh, WHO officials survived, I thought, wow, that's true. Public positions versus private positions. Wow, that I can give you 1,000 book summary about the public position and the private position. And then the politics part of it, religious part of it, community part of it, international part of it, my history versus your history, everything. That will take a series of multiple lectures to solve that. But we reinvent the wheel because there is a hierarchy of evidence. So there is another part I am just taking. There is a hierarchy of evidence in the scientific world. Let's accept it. Bhaskara II's language was not the same language which the French mathematician was using. So they spoke the different languages. So when I say that, we are very RCT centric people. When the same thing is told through the RCT lens, I suddenly feel, wow. So believe that it is the ultimate truth is completely right. But when it comes to the stories, we think, oh, this is more of a common sense. And why common sense I have to study? And that's why there is no wonder that common sense has become a rare sense. That's a different issue. But there is a divergent platform and our appreciation about what is RCT evidence and what is the stories evidence. One of the reasons it is not that people are with bad intent. People are with the right intent. They want to serve the nation. They want to serve the humanity. But the language of the RCT and the language of the story is different. And also the fact that when I know what, I assume that how I will fix it. So while there is a great appreciation for what, so when Albert Sabin or John Salk says, oh, I developed the vaccine, I say, wow. And we believe that, oh, the same people who have developed what will tell us the how part of it. Because we fundamentally don't agree that these are two different sciences. Implementation science is completely different than a traditional science. And when we are trying to look at the scientific heads for looking at us, because somebody has told what, the same person is going to tell me how, and that's where the problem starts. So, and it is no wonder that implementation science, for example, the people for a pretty long time did not believe it is a science itself. Operational research, it is only very, very recently the kind of respect it was supposed to get, it has started getting it. So we have a long way to go. So I will say so long as we try to think that, oh, there will be a time when there will be a deep respect for implementation science, this vicious cycle of reinventing the wheel, one day, in one generation, it will be somehow that gap will be narrowed. And that's what my belief is.
I will, and having made that point, I just want to give a couple of examples. So what and how are different, and I will use the polio lens here. So come 2003 and 4, I think I am audible, right? Yeah. Come 2003 and 4, and there was a massive drop in the confidence of polio eradication. Because 2002, the epidemic had peaked. After we suddenly thought, oh, we do the 3 doses, we do the 3 rounds, and it's done. And suddenly 2002 gave a slap left, right, and center, and suddenly everybody thought, wow, there is something problem. And it put a huge distrust, suspicion among the strong believers of polio eradication. And that's where one of the very strong polio scientists in India, Dr. Jacob John from CMC Vellore, said around 1980s, I had already told you, unless and until the speed of vaccination is greater than the speed of infection, you will never be able to reach polio eradication. Speed of vaccination has to be faster than the speed of infection. Okay? And what was the theory? So I had an opportunity to lead WHO delegation in India's first infectious disease conference in 2004, and that was the point. Dr. Jacob John, one of my teacher and very powerful teacher, and he said polio eradication is not going to happen because per dose efficacy of the trivalent OPV at that point of time is 8 to 10%. And if you are going to work in Uttar Pradesh, where there is a massive endemicity, where there is high sanitation, crude birth rate is high, high density of population, it essentially, in simple language, he said that if you want to do the eradication, you need a cohort of the children which are protected below 1 year of age. And if you are operating from 8 to 10% per dose efficacy, that means before the child becomes 1 year old, the child must have received 10 to 12 doses of oral polio vaccine. Before the child becomes 1 year old, child should receive 10 to 12 doses of polio vaccine in a setting where governance is weak, where heart of Uttar Pradesh and heart of Bihar, we thought, wow, before 1 year, 12 doses. And that's what he said, polio eradication is simply not possible. And that's the scientist said, that's the what part of it. And then when it came to how part of the people, they said, okay, how do we translate it? And I can just give you a simple example how it was translated. People said, no, we have to work it out. And any eradication, whether it is a smallpox eradication or polio eradication, any major initiative in any part of the life, it's led by champions. And champions at all levels. When I say champion doesn't mean only at the tier, every level of champions. So there were a cohort of champions who believed that we can do it. But how to do it then? How to defeat the science which says that polio eradication is not possible in 2003 or 4? We said, okay, why don't you focus on making the child immunized 13 times before he turns 1 year. He or she turns 1 year. Now getting 20 doses for a 5-year-old child or 4-year-old child is easy. But getting 12 doses for a child where there are strong refusal area, there are religious beliefs, there are rumors that OPV causes infertility, so I will not take the male child out, where already because of the infection rate and crude birth rate, the seroconversion rate is very low, no routine immunization. How do you galvanize the same system to deliver 13 times or 10 times in a year? That means your margin of error is almost 0 to 1%. If you do, that means you have to start 12 rounds in a year. And within that 12 rounds, what you can miss is maximum 1 or 2 times. You have to catch early. We said, okay. People came with the idea, why don't we create the registry? But the registry is, if I create the register, the day it is prepared, it is useless. Because cohort is coming, and the person who is not willing to get vaccinated, that family will tell you the name of that small one-day baby is meaningless. We thought, why don't we focus on supervisors instead of vaccinators? So imagine a crude birth rate in India. So if you carry it out mathematically, and I am a doctor, so mathematics is not my core area. So one team covers 100 population, 100 houses per day. For every 3 teams, there is one supervisor. That means one supervisor covers 300 houses. Multiplied by 5, that is 1500 population. 1500 population with the crude birth rate of India will have 2 newborns per month, roughly in that geographical area in 2000. So that means every supervisor, now births doesn't happen like this, they happen like this, but average. So if it is 2 newborn per month in 300 houses, so ideally every team has 0.75 newborns, but there is no 0.75 newborns, so average 2 newborns. For 5, if we work for 5 days, that means 10 newborns per month, because every month round is there. So suddenly we have started found that where there are refusal families or the pockets of the refusal, we are certainly not getting any newborn. Suddenly data start telling that wherever there is a suspicion of strong refusal, newborns are not there. So suddenly we have started asking the question, oh, suddenly the crude birth rate in this particular locality has gone down, right? And I still remember in Hapur, I was taking an evening meeting and I was forcing, and I was one of the worst manager at that point of time. It's still a work in progress, but at that time I was horrible. So I said, where are the newborns? And there was a pressure. He said, kya karu main? Kya chahate kya ho mujhe? And he used another different Hindi words, but aap kya chahate ho mere se? Main newborn nahi hai to nahi hai. And I think eventually we got there. So the whole hopelessness that, oh, we will not go there, suddenly it came to the how people, and they said, no, we can convert it. So unless and until you differentiate somebody who is talking what and how, and you give respect to this implementation science, you will continue to do the same mistake and the same mistakes repeatedly, and we will, today is smallpox, after 50 years polio eradication history will be written, and again after 50 years some other. I just wanted to leave this thought of giving a respect to implementation science while we are working in public health, and I wanted to leave that thought. Thank you so much.
Since we were talking about history, mathematicians, what and how, this also reminds me of Fermat's last theorem, who actually came close to, after like so many steps, wrote in the margin that this theorem seems so easy, and you know, this can be easily solved. And he just wrote that this is too easy for me and I'll just leave this in the margin. And it took 300 more years, became a millennial problem to be solved. So how was the part which was missing, which is so true even now. So Anjali, I welcome you to share your thoughts.
Yeah, do you want to?
Whichever way you wish.
I can just sit here, and it's always, I don't know if it's good or bad to be the last speakers, but in my case, definitely bad, especially if you have 2 brilliant speakers before you. But thank you so much. I've read so much about the polio history, and it's fascinating to read about smallpox and really understand and see the similarities as well as the differences, because you're talking about a different decade and different millennium. So I just want to share 2 stories, nothing as exciting as Devendra did, but more of my personal stories. When I did my, my master's in population studies, I'm not a medical doctor, I keep reminding everyone. So when I did my master's in population studies, and as I was, playing with the numbers and putting it together, and I said, how in the hell are you going to communicate this? So then that's what kind of pushed me to do a communications course at Johns Hopkins. So as we were sitting in a group, we were taught everything, and then we had to present our project. And when I presented my project, the scenario was Zambia, and I had to put together a radio communications plan to help people practice safe sex and prevent getting infected. So my professor looked at it, I made the presentation, the slides were brilliant, and he says, you know, you've really gone by the book, and it's a great presentation, but I cannot give you any marks for it. And I was shattered. So I said, why? He says, you're looking at 33% prevalence rate, and you're talking about assessment, developing messages. He says, by the time so many more people would have died, how can I give you any marks? As a communicator, you failed. So that was a big learning for me. The second learning was, with a mentor of mine, and we were just starting our work in India, I went to see the then Secretary Health, and we were just talking, and he says, if you've come here to talk about vaccines, please don't. I can talk about anything about pneumonia and diarrhea, but not vaccines. So then I said, sir, but you run the largest immunization program. He says, immunization theek hai. So I guess I was too nervous to tell him, immunization happens to vaccines. So vaccines have been a bad word for a very long time. And I think today when I listen to you both, and I wonder how history is going to judge us, because when we look at I'm going to give you two examples. When we look at children dying from diarrhea and pneumonia, under 5 children dying from diarrhea and pneumonia, and these are 216 data, the total number in India was 260,990 annually. And yet, we had a vaccine, the PCV vaccine, pentavalent vaccine, approved in 2009. We had all the evidence. We knew it was very difficult to get local evidence on hip meningitis. We had evidence on rotavirus diarrhea for sure. Pentavalent, which takes care of hip meningitis, was only scaled up the year before. Rotavirus has been scaled up now. PCV has been introduced in 2 states and we've stopped. And children are dying. Another very important data is really looking at cervical cancer. India accounts for nearly 1 in 4 global disease deaths due to cervical cancer. We have, in 2018 alone, cervical cancer were responsible for 60,000 deaths and 96,000 new cases. And these are women dying horrible deaths. We have screening, we have the HPV vaccine, we have treatment, and yet, you know, we're not learning from history and how to introduce it. A lot of times advocates, particularly people like us, I mean, Global Health Strategies does a lot of work on very many public health areas, but we are always remembered for our work on vaccines because that's the most controversial, and particularly HPV vaccine. So my question, and I want to leave this thought with everyone. Today, as you've heard, you know, about smallpox, eradicated, polio, eliminated, and knowing that there is a very interesting Lancet study which talks about that over the next 30, 40 years, close to 160 countries who use all the cervical cancer interventions will eliminate the cancer. Australia's committed and is on track to eliminate it by 2028. We still have so many children dying, and PCV stopped because the the international vaccine is expensive, and I'm kind of, giving a very simple reason. And there is an Indian vaccine coming out. How do you account for the deaths? And why can't we learn from history and say, we should do something? And secondly, how is history? I mean, tomorrow, 50 years down the line, a young professor talks about the history of pneumonia and diarrhea management, or even elimination, and elimination of cervical cancer. Where are we? How are they going to judge us? So I'm going to leave you with that thought.
We'll now take the questions from the floor.
I think we have a kind of a hard stop because Anjali has travel plans and she has to leave in like 10-15 minutes. So yeah, but maybe you can direct your questions to her first, and then we can always discuss over tea or coffee. So I'll collect some questions.
So this is fascinating. I mean, we should do more of these. Especially, I think, because economics, the way we teach it, the way we model, the way we understand the world from the economic perspective, is highly sterile. We have a positive view of things. We don't even have a normative, forget about having a historical or an institutional view. And that too when there are so many histories. But it's a very profound, this example you have also sort of extends to every other aspect of history, right, Sanjay? I mean, we know that history written by the victors is the history that we teach the world. I mean, in many ways, that's a history that, and in some sense, you're trying to challenge that and bring in a prism with myriads of, the different views on. It's fascinating. I mean, we also are looking at what is an implication out of something. Like a deeper understanding of this perhaps gives us a better, view and knowledge. But moving forward, we're still grappling with this opportunity cost of lost time because there's something there and we can't quite do it. And yet, someone has to take a leap of faith. What you call champion on the ground is someone who's so convinced that this is the right thing to do. And in a world where the scrutiny is becoming like a 0-1 game, I mean, if you're held to even smallest misstep, then who knows? In that case, what is the way forward? Are we to go back to the science of it and say, well, perhaps more data, perhaps more use of artificial intelligence, the nuances, fine-tuning, all these operational efficiency bit when we talk about. That capacity then has to be created through this at all levels, including, I didn't know we had pilots. In fact, I felt a bit ashamed when you said that in India we've already had pilots for these, maybe around the same time that we did it in Africa. But I didn't even know that this kind of capacities existed for this kind of research. And of course, because we don't have as many journals, we don't have the culture of research, and forget dissemination and communication, that knowledge just keeps getting lost, Sanjay. So what is the way forward? I mean, and do you see in terms of creating those capacities to tell alternate histories in these parts of the world?
It's extremely difficult. So I've been very fortunate to get Wellcome Trust funding, which is immensely democratic in that they don't tell me what to write. So it's evidence-based, detailed research, and I can take any approach I want. And the trust actually encourages you to push boundaries. So in that context, my team and I are able to do what we do. But it's extremely difficult. I mean, not so long ago, I teamed up with Dr. David Heyman, one of the champions I really respect. When I spoke to a few public health workers in Uttar Pradesh on the ground, they all remembered him because he would come out of the jeep, go to the sick child, go to the stricken child with polio, touch the child, sit down with the parents. Not common. So we made the argument. I think it was a call to create an oral history archive for polio eradication. And in our argument we had to go bottom up. We can't just carry out interviews in Atlanta and say we have the history of polio, global polio eradication. But it didn't work. And the fact that Heyman was there, because I did also believe in the hierarchy of knowledge thing, so therefore I thought, Heyman would, I'm a historian, Heyman is a clinician, he's a public health leader, but there was still pushback. So trying to create an inclusive history is not easy. It's tiring because you get attacked all the time. You have to be very, very sure of your methods. If the evidence base in sort of normal history is detailed, this history has to have even more evidence base because your methods are constantly questioned. So it's a challenge, but I see the PhD students as the future. And we have to fund more and more PhD students with languages. Languages are crucial. I mean, I've had some extremely good British students who just speak English. They can study the complexities of the English language negotiations. But then I've had Brazilian students studying the Brazil case study, Chinese students studying Chinese case study, you know, a student who also understands Swahili and can do interviews in Swahili to understand, for instance, the role of faith-based organizations in international health in Africa, which is often not spoken about. So these are all very, very important. So it's a challenge. We are not going to give up. I hope others join us. And my true delight was in 2008 when WHO made the Global Health Histories program an official audited activity. So that gave us a lot of recognition. That allowed us, we've held 124 seminars with them, where we get a historian or a social scientist speaking alongside a program official, whatever rank. But the most interesting bit is a question answer session when all these retired workers come in and then they start telling us about the complex histories. So those, as we record those question answer sessions, there's just a treasure trove of memories there. And those are international memories. These are not just people from a handful of countries. So a lot to be done, but my hope lies in the future, the youngsters. So hopefully interdisciplinary work is very important. Economics, anthropology, history, all coming together. The data is subjective, as I've learned. Presentation of data, collection of data, production of data. Going into the raw material gives actually very different data. Prachi and I were discussing from the final published report data. If I could throw it in there.
Absolutely awed by your presentation. Just a couple of thoughts, and I've had the proud privilege of being a part of the polio eradication program under Devendra for a while. When I heard what you said, you had mentioned the top-down versus bottom-up, but I didn't hear enough of bottom-up in the historical or the need and gap. And I didn't hear, was there a UNICEF or a Rotary-like being at that point of time? And did they help or did they not? Which polio did have. And the whole concept of community participation, ownership, social mobilization, equity, etc. Did smallpox ever imagine that? Smallpox was a more, I'm a pediatrician, was a more visible disease that had to be somehow hated. Polio didn't have that. That's my first question. The second question was, and I loved you showing Henry Kissinger and Indira Gandhi. But you didn't show the Tatas. You decided not to have a photograph of the Tatas. Was there a reason in history not to show him? Number two, what really motivated him to write a letter? I mean, I do know the Tatas and their legacy. What motivated him to write that handwritten note to Indira Gandhi? I think that was the game changer. Polio, unfortunately, did not see that at all. What we had thought, I was a part of that 5 pediatricians that went to the health minister of Delhi, Harshvardhan, to motivate him. And we thought 5 years, it'll be done. It took 35 years, and we're still going. It'll be really nice to know, was there a UNICEF, was there a Rotary-like being, or no? Was that harmonization between WHO, UNICEF, Rotary, and CDC a boon or a bane? And the last one was there a Ratan Tata or a JRD Tata's equivalent gap today of not wanting to write to the Prime Minister of whatever is needed, a bane or a boon?
Do you want to say anything?
No, I'll leave the question.
Okay. Okay, so the UNICEF was present. So as ever, the deal was that UNICEF would provide aid in kind, and WHO would provide technical support. When WHO and UNICEF both get involved in India in the mid-1960s, both thought they would have a free hand. Both got a shock of their lives and realizing that they were not going to get a free hand. So they were harmonized in shock at the lack of power. That's the only harmony I see. Yeah, that's the only harmony I see. Otherwise, I see a lot of competition. And that competition came from pre-existing competitions during the malaria eradication program. So, you know, sadly, ill feeling lasts a long time. And so many of the wonderful people I've had the privilege of interviewing of all nationalities, including some amazing CDC officials. There were Brazilian officials who worked in Africa and Asia. They would tell us that often UNICEF teams would have better transportation, for instance, but often that was denied to WHO teams in an emergency when they needed it most. One of the things Nicole Grasset did not like about Delhi was that she had a jeep, and often people would come and steal the wheels of her jeep. And then she would often ask UNICEF partners, you know, do you have any wheels spare? And they wouldn't give her any spare wheels, so she had to buy it in the black market. But, you know, so again, the Rotary was, of course, I mean, they were very important in polio in raising money. In fact, Thomas Abraham has written this amazingly perceptive book recently where he wonders why is it that someone like Havdan Mahler, who had opposed vertical programs right through his tenure, it is well known, why is it that in his last WHO speech, why is it that he stood up and said, okay, let's go for polio eradication, challenge the world to eradicate polio? And Thomas was presenting this book, he was in York, and David Heyman was also there. It was a WHO-GHS seminar, and David Heyman suggested that it was the Rotarians who pushed Mahler into changing his mind. So the Rotarians are of immense importance, because till then no one had been able to shake Mahler's innate belief in the importance of horizontal programs and the destructiveness of vertical programs. So the Rotarians are certainly very important. And this is something I think someone needs to, this is why we wanted to interview. We wanted to interview not just CDC officials in Atlanta, but these range of voices that change very powerful opinions. Because the moment Mahler changed his mind, a lot of other people who admired him changed their mind. So, you know, ripple effect. The bottom up was, I littered my presentation with vaccinators' photos. And they are my heroes and heroines. I mean, look at the pay structure, look at the morale. I mean, these were self-motivated people who dreamt the eradication and worked hard. There were no financial incentives in smallpox eradication. So I think it's an insult to lose these voices. But I'm a historian of politics as well, and I'm aware that the last case of smallpox happened in 75, 2-year surveillance for eradication 75 to 77, global eradication 1980, very difficult political times for India. Governments changing, emergency, one of the most shameful periods in Indian politics. So perhaps it was inconvenient to talk about smallpox eradication. Maybe the politics of that era went against the creation of an inclusive history of smallpox eradication. But that shouldn't stop us. We need to go back. I always worry we're losing these voices on a daily basis. These are amazing people, but old. And a lot of people, we're losing a lot of voices. So for me, the bottom up is what the vaccinator is doing, the silences that I talked about, the reports in Hindi that I chuckled every time I read a report in Hindi That was for me the real eradication. Others were important as well, but I usually have an allergy to arrogance. So someone sits down and tells me in Geneva, I eradicated smallpox, then they've lost me, because then I'm not even interested in interviewing them. So I hope that answers question one. Why did I not show the Tatars? Because J.R.D. Tata was convinced by Nicole Grasset. And I think women's voices have been systematically airbrushed out of this history. So in my view, Tata wouldn't have been a player in the smallpox eradication program if Nicole had not convinced him. I tried to interview Nicole. She was quite ill, and I never got to interview her. But she is an amazing person to study through the unpublished archive. She just did not give up. She would go again and again and again. I told you about the letter she wrote to Indira Gandhi, another handwritten letter. I mean, the question we have to ask ourselves, how are these handwritten letters getting into the WHO archives? I suppose, as historians. So I asked Karan Singh this question, and he said that, yeah, we knew it was happening, you know. But then they said we also know what they were thinking. So, you know, it was very porous communication sort of thing. But Nicole is someone who made it her business to understand the political communication networks. So when multiple letters from the WHO regional office were not getting to Indira Gandhi because of being stopped by her secretarial staff, Nicole would always find someone who would carry a letter by her to Indira Gandhi, and then the communication would be held. J.R.D. Tata is immensely important. This was also a controversial time for him because there was the strikes again in his airlines, and you know. So he actually he wanted to help but didn't want to be advertised too much. But it is, I think, fair to say that in 1974, when the last major outbreak happened in tribal Bihar, in the Jamshedpur area, WHO was broke. So if you go to the data and you look at the figures, there was no money left. Swedish International Development Agency funds, because Indian workers had been so confident that they'd done such a good job, had allowed some of this money to be given to what was Bangladesh, that there was actually very little money. J.R.D. Tata stepped in with his Jamshedpur workers, public health workers, doctors, and money. So one of the great untold stories is how Tata money made eradication possible in the fund. But again, I think, coming back to that original point about the politics of the period in the Indian context is not the easiest period to write about, but needs to be written about, if need be by historians not living in this country, but it has to be written about. So you're absolutely right that Tatars are important. And maybe that is something someone should do, a thing of the Tata, with the Tata Foundation archives, study of how the Tata group engaged with the smallpox eradication program. Did the Tatars work with polio at all?
But there were so many Indian
other
legendary people who have been.
Okay.
We are over time, so maybe I'll encourage you people to discuss more over tea or coffee. And thank you so much. And we look forward to having you guys again. This is such an interesting session. Thank you.
Maybe we should do a GHS seminar.